topic is practical tips in management of HMPV. As has already been outlined, already been outlined by the previous speaker, Dr. Ruby, that human metapneumovirus, it's an old virus. It has been circulating since past 2 decades, discovered in Netherlands, and it belongs to Pneumoviridae family. It mainly causes upper respiratory tract infection, and that too in infants. The target group is usually the infants. And one of the most common cause of upper respiratory tract infections in infants is respiratory syncytial virus, which affects children up to the age of 5 months. Later on, from 4 to 8 months, it is mainly the HMPV virus which infects the children. So there's a bit of overlap. Mainly, it shows a seasonal pattern as told by Dr. Ruby. It usually peaks in late winter and early spring. In some patients, especially who are immunocompromised, it can affect the lower respiratory tract. It leads to bronchitis, bronchiolitis, etc. In children, in infants who are immunocompromised or who are premature or have some cardiopulmonary underlying disease, they get a serious disease. They get a lower respiratory tract infection due to this virus. As well as in elderlies more than 65 years of age who are suffering from some chronic condition like malignancy or COPD or asthma, where also this metapneumovirus can create havoc and lead to a serious respiratory infection. The main part, I would like to differ from Dr. Ruby that the period of infectivity is around 15 days after the appearance of symptoms. It is from 5 days to 15 days. So even after the patient has become asymptomatic, the patient can still infect other people. This is what I have got from the net. Symptoms, as have already been described, basically upper respiratory tract symptoms like cough, nasal congestion, rhinorrhea, shortness of breath. And in case of immunocompromised or patients with chronic comorbid conditions, elderly patients, it leads to bronchitis, bronchiolitis, and pneumonia. And when a patient is, when the parents bring their child with a cough, their immediate suggestion is, Doctor, do we get an X-ray done? The answer is no, because X-ray studies don't reveal anything because it is an upper respiratory tract infection. It is not a lower respiratory tract infection. And we cannot even differentiate between a viral pneumonia and a bacterial pneumonia because viral pneumonia is basically symptomatic. It hardly has any signs in X-ray, whereas bacterial pneumonia has a lot of signs. So X-ray studies are not advisable in patients suspected to be suffering from HMPV. It will be a waste of resources and an economic burden. Next is the molecular diagnosis, which Dr. Ruby has explained vividly. These days, it is preferred to go for a multiplex RT-PCR or BioFire, as Dr. Ruby has already explained. Though these tests are not being done because it is an infection that gets cured by its own over a 7 to 10 days of time. So they are costly investigations. They are not being done. In this, we get a panel of viruses is displayed, and then the diagnosis can be made. The secretions are subjected to this. Another thing is, like in COVID, we had a rapid diagnostic test kits. In this, they haven't. There are no rapid diagnostic kits available for HMPV because it's a mild disease. It causes a mild disease, and it might not be commercially viable to develop kit for that. But in COVID, we had a rapid diagnostic kit because it was leading to a lot of damage, mortality, etc. In this, we don't have a rapid diagnostic kit. Now, the treatment is basically supportive treatment. Like if the patient is having cough, then we go for we advise antitussives, antihistaminics. In case of nasal congestion, steam inhalation, breathlessness, nebulization, oxygen support. If the patient is running fever, then we go for paracetamol, non-steroidal, anti-inflammatory. and maintain the hydration with oral or IV fluids. I ask the patient to isolate himself or herself and take rest in case of fatigue. The main point to be stressed is antibiotics have no role, and neither are there any antiviral drugs for the treatment of HMPV infection. Antibiotics have no role. That is to be remembered very clearly and loudly. Now, it is said prevention is better than cure. So how do we prevent it? To prevent it, we should know first how is it transmitted, which has been detailed by Dr. Ruby. It is through droplets from coughing and sneezing, from close personal contact, like shaking hands, touching, kissing, like the mother might be kissing the child. So she ought to wear a mask so that she doesn't get infected from the virus. And touching contaminated surfaces, like fomites, and then touching one's own mouth, nose, and eyes. So prevention is basically, if first of all the patient and the caregiver, they should be made to wear masks, both the patient as well as the caregiver. Then social distancing should be practiced. If the patient is coughing, then they should be taught or educated about cough etiquettes, that is to cover their nose or mouth by the elbow or a tissue or tissue paper or mask, and sanitizing the contaminated surfaces which are frequently touched. And for the caregivers, it is frequent washing of the hands with soap and water for at least 20 seconds before they touch their own eyes, nose, mouth. So basically we have to educate the patients again, as we had in COVID, about social distancing, remind them about cough etiquettes, sanitizing the fomites. These are the mainstay for the prevention. Differences between COVID, they have been already covered by Dr. Ruby, but still to stress one or two points is that HMPV is an old virus and COVID was a new virus of which no one knew the genome, and it was leading to a lot of mortality and a mild to moderate to severe disease. Whereas HMPV is an old virus, it leads to a very mild disease and basically affects the infants, and it has a low mortality. The future, many vaccines have been tried, as told by Dr. Ruby, with virus-like particles, subunits, etc. But now in the pipeline, there is a messenger RNA vaccine being developed by Moderna by the name of M1653. Its phase 1 trials have already been completed and the results are encouraging. That is, good titers of neutralizing antibodies have been detected. But the development of vaccine, the trials, phase 2 and phase 3 trials are slow because basically the demand is less, because HMPV is a mild disease. So the and the outbreaks are usually localized. Hence, people are not very enthusiastic about the vaccine, but it might come in the near future. And as ma'am is also saying, that it might be incorporated in influenza vaccine. Therapies may monoclonal antibodies and short, small integrated RNA therapies are in, they are in the books, they are hardly being used because it's a mild self-limiting disease. So the basic thing is that this takeaway is basically that it's a ubiquitous pathogen, and it has a broad spectrum of illness. There's a large spectrum of illness, from upper respiratory tract infection to lower respiratory tract infection. The diagnosis is primarily by RT-PCR. Supportive treatment is the treatment for managing these patients. Active research for vaccine and antivirals is on. There is no need for any one of us to panic, but because it is mainly a media hype, since it is coming from China, but it is mainly, it's the normal trend of the vaccine, of the virus that is being seen in China. And because of increased surveillance, newer diagnostic tests, it is the detection rate has increased. And because it is coming from China, everyone is apprehensive because COVID also came from China. But COVID was a new genome, new virus, and this is an old virus. Many of us have been infected by this clinically or subclinically, and it leads to a mild disease. So we don't have to panic. But the positive point of this scare is what we should learn is that it should remind us of social distancing, wearing masks, and sanitization of the fomites and hand hygiene. So these are to be re-emphasized, and the public is to be re-educated about this, that they should continue during these changing seasons when the influenza and all these viruses are active. And the government is keeping a vigil on the developments in China, but now as we all see now, the news, the media is not anymore highlighting this news, because it was a normal trend, and most of the people, the special experts are saying that it's an old virus, so there's nothing to worry. Thank you all.
Thank you, Dr. Praveen. So we don't need to panic, but we need to be careful, and the respiratory hygiene is definitely the need of the hour. Thank you, ma'am. Your comment?
I think there no comments are needed. It was self-explanatory. Dono presentation. It is great, I think. But at the same time, I will say that we have seen COVID, and we have lost many things in COVID. It is a bit careful. If you remain, that will be great. Anybody wants to make any comment? Anybody wants to make any comment?
Dr. Meenakshi has raised her hand. Dr. Meenakshi Singla.
किसी को भी कमेंट करना है, प्लीज कमेंट करिए. मेरी बस लास्ट मिनट में फिर सलाह रहेगी कि प्लीज in case if you find any member of your family has is infected, wear mask. Going to the clinic for another 15 days, please wear mask. And फिर त्राही नहीं होगी तो फिर कुछ घबराने की जरूरत नहीं. Good.
No, it was a very concise and crisp presentation, and it was informative. I mean, इतने सी information से अगर आपकी tension खत्म हो जाती है और आपको चीजें पता चलती हैं, तो this is worth discussing this much about a topic, and it has been really good.
I made things very clear. कोई एंटीबायोटिक्स की जरूरत नहीं है, कोई किसी तरह से परेशान होने की जरूरत नहीं, कोई एक्सरे के लिए, कोई सीटी के लिए भागने की जरूरत नहीं, कुछ करने की जरूरत नहीं. समझे, आराम से बैठो.
I mean, it was the right thing to have discussion on this topic.
इसके भी केसेस में हमारे मतलब कुछ ग्रुप में ऑलरेडी HMPV वायरस जो के केसेस हैं, कोविड के सीटी और इसके सीटी में बहुत ज्यादा डिफरेंस नहीं है. Pneumonia looks like the same in the CT scan. So, and the treatment is also the same. Like only the patient who are elderly, they might need the oxygen support. So that's why they are just getting admitted, and with the different comorbidity, especially who are immunocompromised. So those people need to have the concern, and especially Madam has rightly said the flu vaccine and pneumonia vaccine. We have the 3 vaccines available for the elderly. One is the flu vaccine and 2 type of the pneumonia vaccine. One is the Prevnar Pneumovac 13 and 23. So all these things as a routine about people who are having the comorbidity or people who are elderly should be taken. So at least कहीं ना कहीं किसी ना किसी वायरस और किसी ना किसी उससे निमोनिया से प्रिवेंशन तो होगा.
डॉक्टर साहब जरूर होगा. यहाँ the message is very clear, loud and clear. People should take flu vaccination, and when it comes to flu vaccination, everybody is important. 5 areas सबको मालूम है कि ये infants, pregnant ladies में pregnant lady को तो छोड़ दिया तो अच्छी बात है. Elderly लोगों के लिए और जो भी hospital में काम करते हैं उन लोगों को फ्लू का वैक्सीन जरूर लेना चाहिए. सेकेंडली जो है जिन्होंने निमोनिया का वैक्सीनेशन नहीं लिया है, मेरी रिक्वेस्ट उनसे फोल्डेड हैंड से है कि आप ले लें. बार बार उसको लेने की जरूरत नहीं, जस्ट लाइक फ्लू वैक्सीनेशन. सो दे मस्ट टेक इट. जो भी वैक्सीन आ जाएगा उसको तो बचाव तो बहुत अच्छा रहता है. मैं तो अपने घर की बात बताती हूँ. हमारे एल्डर्स इन द हाउस से सिंस द टाइम दे हैव स्टार्टेड टेकिंग फ्लू वैक्सीन, उनकी जो रेस्पिरेटरी मॉर्बिडिटी विंटर के सीजन में रहती थी वो खत्म हो गई.
Thank you, ma'am. Thank you for the advice.
Thank you, everybody.
It has been great. Thank you very much.
And wish you all a very happy Lodi and Makar Sankranti.
Yes. Thank you very much.
Thank you, ma'am. Happy Lodi.
Thank you.
Thank you.
Thank you.
Vandana, how was you've come back? Dr. Vandana?